Two patients can both be sitting alone, but the psychological meaning of that situation can be completely different. If this distinction is not observed, their behavior can be misinterpreted. Hi, I'm Sankamitra, a psychology student. I share what I learn in a simple way. During my psycho-oncology exposure in Indian Institute of Head and Neck Oncology, I observed that some patients remained quiet and disengaged, even when family members were physically present. At the same time, other patients were also alone, but due to different situational factors. In some cases, patients with visible post treatment facial change show reduced eye contact and limited verbal interaction, despite the presence of others. This can be understood as withdrawal, an internal response involving reduced social engagement. In contrast, a patient may be physically separate during treatment, or may have consistent social presence, or may be alone due to medical condition. This reflects isolation, which is primarily situational rather than internally driven. So the distinction is withdrawal is internally mediated disengagement, isolation is externally imposed or situational separation. In clinical observation, the same outward behavior, being alone, may represent different underlying psychological process. Being alone is not a uniform experience. It depends on whether the response is internally or externally driven.